Around 1.7 million people are to be added to the shielding list in England after experts identified additional adults at serious risk of COVID-19. The list was expanded after scientists developed a new tool to assess whether someone is at risk of severe disease or death. Those identified, who are between 19 and 69 years old, around 820,000 people, will now be prioritised for a vaccination. Our political correspondent Joe Pike joins me now. A large number of people being added to the shielding list, Joe. Do we know who they are?
We don't yet. There are 1.7 million of them, and they should be getting a letter imminently. This is the result of some Oxford University modelling into the impact of COVID on certain groups, the risk of people having a pretty negative response if they get the virus. Up to this point, those people who have been shielding have often had a single factor contributing to the fact they are shielding, usually one key underlying condition, such as a severe respiratory condition or a certain type of cancer. Now this modelling has put together different factors, a combination of factors. So I think still key in those people added to the list is likely to be an underlying condition, but added to that factors such as age, body mass index, ethnicity, as well as potentially a postcode if somebody lives in an area with high levels of deprivation. If you are on that list, as I say, you should get a letter imminently. If you are under 70, you'll be prioritised for a vaccine. You should get a vaccine pretty soon. You'll also be asked to shield at home until the 31st of March. And finally, if you are shielding, you get the same support everyone else already does who is shielding, including statutory sick pay. This is a massive change, though. 1.7 million people added to the 2.2 million already shielding, almost 4 million in total. What it also tells us, Sarah, is scientists' understanding of this virus and its impact on people's health is changing fast. And I suppose the government and the Department for Health would also argue that their response is therefore moving fast as well.